Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department, and I'm talking to Miss Carol Cannon. She's the Director of Behavioral Health Services here at the Mobile County Health Department. Carol, how are you?
I'm good. Thank you, James. Good morning.
Hello and good morning and good afternoon, depending on when you're watching this. Um, Carol, so you're on Wellness Wednesday because we're going to be talking about a a variety of services that are offered by the health department directly under your department. So can you give me I know that there's a very long list, but can you give me a quick overview of everything that you do?
Yeah. One of the benefits of being a patient at the Mobile County Health Department is not only do you have a doctor and a nurse that you call on for assistance, but you also have different layers of behavioral health staff that can assist you, starting with someone who can help you apply for health insurance so that you are not paying out of pocket for your health care, or at least paying less out of pocket if you have copays. We have folks who will help you if you're uninsured, get free medications through the pharmaceutical companies, or direct you to low cost medications at local pharmacies if it's generic. And we have community health workers that are working to help ensure that people are coming in and keeping appointments. And if they miss appointments, they follow up behind them. And we have licensed social workers that work with doing assessments of patients. Because, back in the day when you used to go to the doctor, they'd hand you your prescription and you went in and got it filled and everything was fine. With the barriers that we have in our community today, there's a number of barriers that can prevent you from being able to get better if you can't afford that medication, or you can't get to the doctor, or you're so concerned about where you're gonna eat your next meal or sleep the next night, you're not really worried about your health care. So one of the roles of the case manager is to do an assessment to determine if you have any barriers, and then help you address those barriers so that you can focus on your healthcare issue. And in recent years, we've added a new division, which has probably been a dream of mine in my entire career, is that at your local health department, your local doctor's office, you can also see a mental health therapist. We have licensed social workers and licensed counselors who actually offer therapy for individuals, family, and marriages, to work on anxiety, depression, any issues, domestic violence, any issues that you have that's keeping you from, because the quality of life is not only physical, it's also mental health as well. So we see all that as impacting your health, and we put a lot of value in making sure you have all the services that you need to be successful with your health care. So we wear a lot of hats, but we think we make a big difference in the community.
Yeah, absolutely. I mean, we know because we're here every day, but 2020 obviously was very challenging for a lot of people with things being shut down, people stuck at home. They were stuck with their spouse, maybe more than they wanted to be. Um, so, it created a lot of anxiety, depression, tension, things like that. So, we've had several behavioral health specialists on Wellness Wednesday in the previous weeks, and we will never run out of topics to be able to talk about because these are ongoing things. These are always issues that people are going to face, and we're just very thankful that we can have that service that, healthcare, as we know, healthcare has evolved. It's more like, you said it's more than just getting your prescription and going home, taking your medication. Now there's so many other factors that people have to get information on. So
Mhm.
it's kind of good that we're the one-stop shop for them. Um,
Absolutely.
anything else about your department used to be called social services, which
Right.
covered a bunch of the things that you discussed. But we realized that this there's a better category, right? So it's all overall behavioral health, and behavioral health fits someone's physical, and it also fits their mental health and their state. So I guess it's a testament that we evolve as times evolve.
Absolutely. Yeah, one of the things that we've been looking at in the from a community or national standpoint is the effects of trauma and the effects of trauma on young children, and that children who have multiple trauma hits as children, whether it's domestic violence or a death in the family or physical abuse, that it can eventually lead to a chronic disease in later adulthood. So we've learned that the physical and the mental are not separate. They're all connected. And
Mhm.
so we've really focused on trying to make sure that we protect our children as best we can and then help our patients understand their chronic healthcare disease and improve it. And one of the things we've been working on in the past year is some of the medical benchmarks that the agencies are required to uh, assist with in terms of helping a patient do better. One of them is called the Diabetic Initiative, and it's our patients that are diabetes. We want to make sure they're coming in every 3 months to get an A1C, which is a blood test to determine how stable their blood sugar has been over the last 90 days. Your blood sugar could be high today, but normally it's not high. So that's what we want to know is what it looks like over time, and that if we can keep you at a the good level is 9 or actually 7 or below, then that means you have controlled blood sugar and you're less likely to have side effects to the diabetes that can affect your kidneys, your eyes, and even cause a loss of limb. So, not only do we do the social services, the connection to community resources, but we're also part of the medical plan of the provider, so that we can help the patient be as healthy as they can. So you can have a chronic disease, but if you manage it, you probably will die more likely from a car accident than you will from your
Mhm.
chronic disease. So those are some of the things that we're working on as well.
Yeah, and those are things that are good for people to know. I mean, we have specialists in each one of those areas. We have specialists,
Right.
dietitian specialists that specialize in only diabetes.
Hmm.
So, if someone is searching, we would likely have a specialist to be able to help them. Now,
Right.
there's other things that we're involved with also too. Something that we do every year. Uh, Maybe talk a little bit about the Toys for Tots drive that we're
Absolutely.
involved with. So,
Yeah, absolutely. For a number of years, we have been running just a campaign in the holiday season to raise money for Toys for Tots, because so many kids will not have anything under the tree if they did not have assistance from one of the Christmas tree initiatives. And so, what we do is we raffle off tickets for people to be able to dress down on certain days of the week. And then we collect that money and give it to the Toys for Tots. And we've tried every year to exceed what we did the year before. And even though this was a trying year, our heart went out to all of the children and so many more children without resources this past year. We were able to exceed our amount from last year despite the trying times. We've raised $2,653, and we'll be donating that to Toys for Tots for next year's campaign. The way we run it, we can't actually get the money to them for the current year, but it helps them get a little ahead of for next year. And
mhm.
so it's a fun time. A lot of staff in the agency help us put that together, from James, who produces the tickets, to our money collectors and ticket sellers, and just those who promote the program. And it's just a fun time around the holidays for us to give back to someone else. And I've always been proud to work with that program.
Yeah, interesting of note is we do all this internally.
Yes.
This is all employee driven. So
Yes.
all of the donations that we've been able to collect every year, that's internally. We don't solicit from anywhere outside of the agency.
Right.
So I'm very proud of the Mobile County Health Department to be able to keep exceeding that goal. We've got a lofty goal, but we've exceeded it every single year. Carol, anything lastly that you want to add?
Just reach out if you need some social work, some assistance, or you have some questions. Each of our clinics has an assigned social worker to them. They're at those sites part time because they're covering more than one site. But just reach out to the clinic that you attend, and you don't really have to be a patient here. If you need resources, feel free to give us a call, and we'll offer you the assistance of what resources we're aware of.
All right, let me give the appointment line number. That's probably the way people will start first. If they
Sure.
will call our appointment line at 251 690 8889, talk to those very nice ladies that answer the phone, tell them what services they need. They'll be able to help them with an appointment close to where they are at one of our locations throughout Mobile County. And that's the starting point. Just go ahead and make the
Absolutely.
call and get in the queue in the system, and we'll figure out how we can help them best.
Absolutely.
Carol, thank you for your time on Wellness Wednesday.
Thank you.